Hello, my name is Milford Kamara. I'm a student at the Midwestern State University. Today I'll be presenting my capstone project titled Reducing Mental Health Stigma in Emergency Department. In the current healthcare environment, it is important to reduce the stigma associated with mental health in emergency department. Emergency departments are often the initial stop for psychiatric crisis patients. However, stigma can worsen mental health symptoms and hinder treatment. Despite the rise in mental health related ED visits, many departments lack the expertise, standards, and compassionate care. This capstone examines evidence based measures to reduce stigma in emergency mental health care. This project will focus on staff education, patient centered communication, trauma informed practices, and environmental redesign. The goal is to improve results, promote dignity, and ensure it is as safe, effective for all mental health patients. The rationale of this study is to promote safe, inclusive, and responsive ED environment, and also to empower nurses to dismantle stigma at structural, interpersonal, and interpersonal levels. As stated, emergency departments are often the first step for mental health crises. However, many are still ill prepared to provide coordinated support. Such neglect causes patients to feel dismissed, devalued, and dehumanized, which hinders care, worsens outcomes, and deters future help seeking. Transformation is possible despite these obstacles with staff training and improved patient provider relationships. The background and significance to this capstone is to promote evidence based solutions to transform ED psychiatric care into a coordinated, stigma free, inclusive, and respectful environment. Institutional bias and fragmented systems impair compassionate care in EDs, such as staff limitations, inadequate trauma informed training, low mental health literacy, diagnostic errors, and excessive restraint use. The problem statement, otherwise the PICO statement of this presentation, is represented by the adult population presenting to the emergency department with mental health conditions, and the I, the interventions such as implementation of trauma informed care and stigma reduction training for ED staff, and then the C, comparison. When compared, there is less stigma associated to standard ED visits, and then the outcome is to improve patient experience, reduce perceived stigma, and enhance care coordination. The proposed plan of this project is to transform EDs into safe, equitable, and dignified spaces for all mental health crisis patients, and to engage patients, family, and community partners in shaping interventions. Also, to use progressive rollouts and stakeholder engagement to maintain momentum and long term impact. Literature review. Growing research supports the urgent need to reduce mental health stigma in emergency departments. Although implementation is patchy, the scale found systemic flaws such as inequitable care, poor communication, and lack of patient autonomy, especially for psychiatric patients. Mental health stigma often intersects with race, disability, and the socioeconomic status of patients, thereby fostering inequitable treatment, poor communication, limited patient autonomy, and care. Evaluation. The goal here is to address emerging challenges, refine interventions based on real time feedback and evidence based practice, ensure long term relevance and impact, and also to conduct interviews with patients, families, and staff to capture lived experiences and feedback in areas such as shorter and safe ED visits, higher patient satisfaction, fewer or non neglected or overlooked patients. To implement this project, first we need to train nurses in realistic de escalation scenarios to enhance compassion and reduce coercive practices. And secondly, we need to create sensory friendly settings and soothing zones to reduce trauma related stress and improve satisfaction. Thirdly, we need to train nurses so they will gain confidence and foster therapeutic partnerships, improving equity and collaboration. And then also, we will need to embed stigma reduction strategies into onboarding, workflow design, and professional development to ensure long term impact. In an interview with Idris Fadika, an expert, reveals stigma is often rooted in fear, ignorance, and inadequate training. Therefore, the critical role of patients and families in shaping policy and care plans should be emphasized. Dissemination strategies should include legislative lobbying for stigma reduction mandates, environmental redesign to create a safer and more respectful ED spaces, and to promote mental health and cultural literacy among staff. In conclusion, collaboration improves clinical outcomes, reduces mental health burden, and empowers nurses to lead stigma reduction efforts. Reducing stigma also requires strong leadership, training, and resources to establish equitable, patient centered care environments that redefine compassionate care in high pressure ED settings. Thank you for listening to my presentation and have a good evening.